Good evening. My name is Leanna Iglinski. I am the current manager of patient flow, the nursing coordinators in patient placement, tertiary access, and house supervisors for Advocate Aurora Healthcare St. Luke's Medical Center's main campus. Our meeting today is to share the strategic goal that has been assigned to the Department of Patient Flow throughout the hospital to improve better throughput. Currently, our ED volumes are very high, with multiple days of high boarding, impacting patient flow, decreasing patient care outcomes, as well as impacting nurses and physician productivity throughout hospital-wide. The purpose of this very aggressive goal is to increase patient throughput, which would result in increased financial returns, as well as increase our patient safety goals and patient safety outcomes. The goal that has been created for the department includes increasing the percentage of patients placed from our emergency department within 10 minutes or less to an aggressive target of 60% by April of 2020. Our current rate is 37%. Although this is a hefty goal, we do know that the urgency of this nature is to put together initiatives and assign tactics that will increase rapid turnarounds and not set short-term goals so that we are able to meet our target of 80% within the following 6 months. The reason we're doing this goal, again, as I stated, is to be able to focus on patient safety initiatives and better outcomes by having proper patient throughput. A symptom of poor patient throughput is increased boarding, delays in placement, and an inability to accept patients from our tertiary sites to our medical center, which provides higher level of care that is not able to be replicated at any of our sister sites within our system. This team will be communicated to, first and foremost, through my communication to the teams directly affected in patient access. These are bedside nurses that work in a department and look in patients' charts to determine the best appropriate needs for placement. The tactics that we will put in place will be created and supported by this team. They will all have a voice and an opportunity to discuss process improvements, to feel part of the team, as well as to increase buy-in. Then we will broaden out these tactics and share education throughout the hospital in various venues. First of all, educating charge nurses in a group forum, more like a town hall session, will actually notify the charge nurses of the new duties that we will assign to them by not allowing to refuse patients if there's open bed capacity and appropriate patients to fill those beds. We will allow for avenues of follow-up and case review on an as-needed basis so that teams are aware that they do have a voice and they do have a stake in helping our process improvement. However, we do not want to compromise immediate patient care, so this is why it is urgent that we get education out to all floors and all stakeholders in this of the new aggressive changes and the administrative expectations. There will also be education provided to our physician stakeholders and leaders. One of the main stakeholders in patient throughput and achieving optimal throughput is partnering with physician disciplines. We need to share with our physicians that with their help and support, we are able to place patients as they discharge. We are able to place our incoming patients. This has been a long struggling goal at the medical center, as many of our discharge orders that are written are conditional orders, as well as requiring multiple phone calls to providers. It is not as easy as obtaining a regular discharge order because it is much more complicated and requires a lot more coordination. By streamlining these tactics, it will increase patient placement's ability to place our patients within 10 minutes or less into a bed. We will also begin assigning patients to beds in dirty beds, which is currently not practiced house-wide. The purpose for this change and broader education to our floor staff on this practice change is largely due to waiting for a bed and ED not knowing that there is a plan coming up for those patients. Our new aggressive goal to assign patients in dirty beds will not only communicate to our emergency department that we do have a plan for your patient, it will also communicate to our environmental services department and prioritize them into the rooms that they need to be cleaning. Our ultimate goal is to get all of our patients to the right bed at the right time. These metrics will be measured through our electronic health record. The electronic health record is able to pull monthly reports, show pie graph analysis, as well as show any barriers such as communication notes that are documented by staff. These metrics will be produced once a week on a bulletin board in the department and shared largely at our monthly staff meetings, as well as shared bi-weekly in our administrative safety huddle meetings with all leader disciplines present. By measuring these metrics, we do have a history of indefinite time periods, and we can show visually improvement or visually show improvement. Lastly, by measuring these metrics, our team is also going to have this as their annual goal. By tying our team's goal to their performance, it will increase buy-in and show them where they have control in making these and yielding these metric outcomes to be financially successful for our employees as well. Each employee in the patient access department will have a goal of increasing the patient placement time for the year to 60%. And we will all be evaluated as achieving that goal as either fully successful. Anything over exceeding 60% will result in a fully successful year. Possibly at 70% would also incur a rating of exceeds expectations. By using this plan and aligning our stakeholders, educating them, and providing them town hall sessions so that their voices are heard, we will be reducing anxiety, providing more education on the process, and communicating the large aggressive goal that our administrative leadership is in support of. I thank you for your attendance in this presentation. Have a great night.